Ano naman natin, LOL, di ba? Laugh out loud. This is every other day. Meron kayo natutunan na naman. Sige, EOD, every other day ang palito, hindi po every day. Na ito lang po sa washcloth, mabalikan ko lang. There are some mothers, syempre, busy, the washcloth stays the washcloth for about sometimes 3-4 days. Yung pa rin ang washcloth na nagagamit. And then, it's not totally cleaned out after the bath. Tapos kung minsan kung saan-saan lang pinapatuyo, etc. So that's why itong ibig sabihin ng clean talaga pong clean. Kasi po kawawa naman ng baby kung medyo madumi yung washcloth, no? Just for us to keep that in mind. And then the water temperature, parang body temperature, 37 to 37.5. Eto, tignan nyo. Yan o, gaano kalalim yung tubig? Up to the baby's hips. Ayan. Kompleto na yan. I think about how to give the baby a bath. Any questions at this point, Jamie? Yeah?
Sir, tungkol sa bathing, wala pa naman po. Pero if there will be questions, we will take note tapos sasagutin po natin mamaya.
Good. Kasi ang title natin, FAQ, di ba? Frequently questions. Kaya syempre, ang hari dito yung mga magtatanong, ang viewers. Now, napansin nyo, meron kayo napansin dito, bubbles. Saan dito, Doc, yung soap? Doc, wala kasi sinabing soap dyan. Soap is a big subject here. It's quite an important subject. So let me deal with that a little bit. No? Okay. What is soap? Ano ba talaga ang sabon? Traditional soaps are made out of, noon, they get the fat of animals, animal fat. They put it in water, they boil it, and they get abo or apog, which is an alkali called lye. And when they mix it, pag nag-evaporate na yung tubig, ang kalalabasan nun, sabon or soap. Now, just to mention, what is an alkali? The opposite of an alkali is an acid. Acido. Acid, like vinegar, di ba? Acid yun. We make mention of that because the skin naturally acidic. Ayaw po ng balat, ang opposite nun, alkali. Ang problema, traditional soaps are made out of alkali chemicals. So that's a problem, isn't it? No? Please bear that in mind and we will move forward. That po ang traditional soaps. Animal fat. Does so now work? So ito, makikita po natin, ayan. Take a look at this hand. Ito po fake to talagang dinumihan yung kamay niya. So anyway, why does the dirt stick on our skin is the first question. Do you know why? Well, not only because dirt is usually sticky on its own, but because we have oil and we have secretions from our own skin, which makes it very conducive for the dirt to stick on our hands. So how does the soap work? And you can read here now that the soap actually encapsulates or surrounds the oil and the dirt on the skin, so that through the process of emulsification, magmi-mix po yan readily with water, natutunaw in other words. Yung langis at yung dumi na kasama sa balat kapag hinuluan ng soap at tubig, matutunaw po yan and it's so much easier to wash it away with rubbing and scrubbing. That is why if you remember, you've come from somewhere sa labas, malagkit ang balat mo, maliligo ka, nagsabon ka. Anong pakiramdam natin? We feel smoother. We feel less sticky. That is the nature of how soap works po. Yun, okay? So you know na. How does soap work? Next. Doc, may diferensya ba ang sabon sa detergent? The answer is actually yeah. Okay, so let me see here, no? Traditional soap, since ancient times, during the time of Jesus Christ, meron ng sabon. Ayan, detergents, lumabas lang yan since mid-1900s, no? So it's very recent. And this is made out of natural ingredients na katulad sabi natin. This one, however, is made out of synthetic and special substances. And again, you can see here, yung pH, how we measure acidity, pH po. Ang neutral na pH ay yung pH or yung asim ng water. Wala pong asim ang tubig, kaya pH po niya 7 or neutral. Ang acid po below 7, ang alkali above 7. So yun po mini-measure namin kapag tinitingnan po namin yung mga magagandang sabon and detergents. And so, ang traditional soaps po magandang pangtunaw, mas magandang pangtunaw po ang detergents. Okay, so yan lang pa. Meron to, ito ngayon ang importante para sa mga babies. Synthetic detergents, dahil yan po ang uso ngayon. Now, we can read here that these substances are made out of different detergents or surfactants. Special process pong pagpagawa sa kanila. They are certainly more gentle on the skin. They are less irritating, especially for those with special skin or sensitive skin po. We will talk about that more a little bit, yung mga sensitive skin. And it also works well even in hard water. Ano po yung hard water? Yan po yung deep well. Galing po sa ilalim ng ng ground. It usually has calcium and magnesium. Kapag po yung hard water pinaghalo sa regular soap, hindi po bumubulak, bali wala pong sabon kasi may chemical process, nagkikik sila yung sabon. Kaya these synthetic detergents, if they are the correct type, they work even with hard water. And of course, kasi napaka-special nila, it is usually more expensive. All right. So now, can I just give you some samples of the ingredients making up Sydnets? And these are the good ones because they are the ones that are plant-derived. Ito po, mabasa lang natin. Cocoa glucoside. Ayan po, yan siya. And then meron tayong decyl glucoside. Ito po siya. And then we have lauryl glucoside. Ayan. Then sucrose, cocoa weight, ayan po siya sa baba. And finally, dun din po sa baba, yung capryl glucoside. Doc, why are you showing us that? Because when they conduct a foam test, makikita nyo ngayon dun sa 5 na pinakita ko sa inyo, they're very common Sydnets. Which ones foam the best? Ayan, makikita nyo. These are the ones that foam the best. Is this even important, Doc? Pang doktor lang yan, di ba? Hindi, hindi. This is for everybody because eto just a few days ago, pumunta ako ng grocery. Sabi ko, sige nga, itetesting ko yung aking lecture kung totoo. Ayan, kinuha ko ng picture ang simpleng liquid ordinary laundry detergent. At ito po, makikita natin yung kanyang ingredients. Ayan, merong anionic surfactants. Nabasa nyo earlier, merong nakalagay non-ionic. Electrical charge po yan ng surfactant or yung Sydnet. Hindi po natin gusto yung anionic. Gusto natin yung non-ionic. Mapalik ko lang ng konti. Ayun, nakalagay non-ionic. Okay, so, ayan. Meron din naman siyang, meron pa siyang magandang product. Hindi, puro perfume. Matatapang po ang products nito, yung regular. Let's take a look. Ito, yung baby eco-friendly, hypoallergenic. Is it really better? Well, let's take a look. Water. Ayan, hirap nga bigkasin Cocamido, dopropyl, betaine. It's plant-derived. Cocosulfate, plant-derived. Ito, mas mahaba pa. Plant-derived din. You see? Kaya lang, meron siyang preservatives. Hindi natin gusto yun. But you could see now that this hypoallergenic detergent for babies, the Sydnet, has a lot of good plant-derived products. And so it really pays for us, lahat po ng nakikinig, to really look at the labels because it does really help. Ayan. Okay. So ngayon, balik na tayo sa paligo. Alam na natin yung mga types of soaps na pwede po natin gawin. Nakalagay po dito ngayon, safety measures. And I really want to talk about this because You know, Jamie, I don't know if you've had any experiences, but I have had patients dumating sa ER. Wow, Doc, sorry eto, dinala ko yung aking anak sa ER dahil nagka-aksidente habang naliligo. So take a look. What is wrong with this picture? Ito po yung bata kamukha ng aking apo si Mateo, pero hindi yan si Mateo, di ba? Di ba mas pogi yung apo ko?
Siyempre,
anyway,
sir.
di ba? Medyo social yung kitchen niya. Ginawang shower. Right? Oo.
Yes.
Okay, as I was saying, bathing must be in a safe place. One of the things that I was mentioning, yung batang dumadating sa ER na pasyente natin, Jamie, ano nangyari? Nabanglian.
Yes.
Scalp burns, right? You remember those patients of ours. Bakit? Natapunan ng hot water, etc. O kaya, Doc, sorry, nandito kami sa ER. Why are you in the ER? Kasi po, nadapa, nahulog yung bata. Nadulas. O kaya, nabasag, may nabasag. So, nasugatan yung bata. Please bathe in a safe place. And at the same time, please check the materials you're going to use. Yung toys, saan galing? Yung washcloth, again, right? Are they all clean? Oh, eto, obvious naman, di ba, Jamie? Never leave the baby alone in the bath. So I'm sure I don't have to say that. But here's the question. Kung yung nagpapaligo, biglang narinig yung cellphone niya, kumikililing, malayo. Pagkatapos yung ringtone, yung importante. Yung ringtone, uy, kailangan kong sagutin to, ang layo. Anong gagawin mo ngayon? It says, never leave the baby alone in the bath. Nako, struggle. But you have to make the right decision. Diba? We all have to make that right decision. And then finally, check the ingredients used for bathing. Dok, ang kulit mo Yeah. Okay, here we go. Again. So these are dangerous chemicals in, well, the things that you use. I'll tell you which are the ones common. Chlorine, bleach. Napaka-common yan, hanapin yan. Ito talagang deadly to, dioxide. Wala na yata yan. Brightener's. Minsan, ginilalagay nila yan. SLS, sodium lauryl sulfate. Yan. Madalas din yan. Mga ammonia products. Siyempre, fragrances and perfumes. So, halos lahat naman may fragrances and perfumes. Deadly ba yan? Hindi naman po deadly, pero kapag sensitive ang balat nyo, ano mangyayari? Aalma yung sensitive skin nyo dahil sa fragrances, perfumes, coloring, and dyes. So, ayan po, mga watch out natin, ha? Okay. So now, let's see now. Everything good. Dinaligo na ang bata, walang insidente. Now, are we purposeful in setting aside a place where we will put down the baby? Nahanda na ba po natin yun? That's very important because, again, we have to secure the baby with a clean, dry towel and be pat dry in our special area. We need to check all the areas of the baby's skin for irritation and dryness as well, di ba? And if you don't have a nice, well-ventilated at maliwanag na lugar, puro shadows, madilim, nagmamadali tayo, hindi po natin magagawa itong proper checking. What are we checking? First, the scalp. Then let's check behind the ears. Yung nape, yung batok ng bata, yung leeg, yung kilikili, yung singit, lahat po ng mga areas na usually hindi po natin chine-check. Let us try and check it. And pag makita na po natin na, let's say there's some dryness, then of course we will need to apply the oils. Ito po, you can see, there is, there is virgin coconut oil here on the baby. We can actually do a massage before or after bathing with virgin coconut oil. Because virgin coconut oil has a lot of good oils. One of them is lauric acid. Lauric acid is quite good against bacterial infection and even viral infections. And that lauric acid has a high quantity to be found in our virgin coconut oil. Doc, meron akong virgin olive oil. Pwede ba yun? It's okay, but Ang problema ng olive oil, it has oleic acid. Yan ang isa sa mga base ng ating olive oil. Kaya oleic acid naman is a more known irritant for baby skin. So between the two, kung meron naman kayo, mag-virgin coconut oil na lang po tayo, right? And then of course, when we dress the baby properly, pinakamaganda, soft cotton clothing, at yung diaper area. Ayan. So, siguro po pwede natin pag-usapan din ang diaper area after a while. Ito, yung moisturizer, nakalimutan natin. Madalas marami nagtatanong sa akin, Dok, ano bang magandang moisturizer, di ba? So that's our slide on moisturizers. There are different kinds of moisturizers here. Okay, that is the generic. Now, we have things called emollients. Ito po, this is what makes the skin feel softer. Yan po, lanolin, petroleum, jelly, dimethicone. Humectants naman, yan ang para hindi matuyo yung balat ng bata. It retains water. Glycerin, hyaluronic acid, lactic acid, urea. And ito po yung mga special products. These are special fats or oily substances produced by our own skin, and now they are able to produce it synthetically in the industry, in the cosmetic industry. Kaya kapag meron po kayo makitang ganito, mas mahal po to, pero it certainly helps the skin as well. At the end of the day, moisturizer selection really depends on where you live, anong scenario nyo, syempre kung ano rin ang nasa budget, lahat po yan we take into consideration. Right? Okay, Jamie, baka meron ng mga nagre-raise ng hands dyan or something? What do you think?
Oo nga, sir. May nagre-raise po ng hand. Pwede pong pakitype po sa chat box yung question niyo po, tapos we will address it later.
Okay, great.
After the talk.
Ayan, ito. Favorite to ng mga tao, di ba? Okay, so you can see here, yan po ang gusto nating iwasan. This is simply and plainly your diaper rash. Now, a diaper rash is really caused by just a few things. Number one, the feces and the urine. Feces and urine have chemicals and germs. We'll just simply put it as that. These chemicals and germs, when they come together as a cocktail, is very potent in irritating the skin of babies in those sensitive areas to begin with. Natutunaw po nila talaga yung balat and then irritation. And so you could see here that all the redness is where there is contact with that toxic cocktail na of poops and wee-wee. Kita nyo? Dito sa areas ng folds ng skin, nasaan yung redness? Wala. Kasi wala pong contact doon sa ayaw natin nga, sa soiling. So keep the area always clean. Keep it dry and well ventilated. Wash gently with water. Doc, what about wipes? Wipes, di ba? Daming magagandang wipes. Meron palang mga antiseptic na wipes. Can I use that? You can, but you might produce more irritation. Also, I think you might be able to save a little bit of money if you just use simply clean cotton balls and just plain water. Diba? And paano to, Doc? Anong ibig sabihin ng keeping it dry and well ventilated? I would imagine for those who are breastfeeding, diaper soiling happens more often. Mas madalas mag-soil ang bata kapag breastfed at malambot and medyo mas acidic yung kanilang poops, no? Yellow and soft, sometimes oily. And so, maybe every 30 minutes to 1 hour, silipin nyo lang. It doesn't really take more than 10 seconds to open the diaper. Take a look, and if it is good, close it again. Diba? Or have someone designated to do that. And in that way, you can really keep the area clean, dry, and more well ventilated. Next question. Use absorbent diapers. What is the best diaper to use? You know, I use the term super absorbent diapers. What are super absorbent diapers? Kapag pumupunta kayo sa supermarket, tignan nyo yung mga diapers na may gel sa loob. Yung kapag nabasa, tumataba, may malambot na gel. Those are super absorbent diapers. There are even, in fact, some already with protectants and emollients na naka-coat na sa lining ng diapers. They're also very useful. And so you see, we have here zinc oxide paste or ointment. It says protectant barrier. What is a protectant barrier? It's like maybe yung kotse. Kapag po ang kotse nyo, nilinis nyo at ni-wax nyo, what does the wax do? Well, when it rains, water will just dribble down kasi ang diba, may wax coating. Yung wax coating po ng car, yung po ang zinc oxide sa diaper area. And so you apply it only may perhaps maximum na once, twice a day. Apply it evenly. Huwag po yung kapag nagpapahid ng moisturizers, ng creams, ng protectants, whatever, para lang matapos. I've seen some mothers do that, na nagmamadali lang, tuloy, hindi magandang pagpahid, hindi even ang pagpahid. That also sometimes is a big factor kung bakit pabalik-balik ang diaper rash. Okay.
Yun pala nangyayari, sir, sa diaper rash. No? Tsaka yun pala yung tama nga, yung wax ay parang zinc oxide or yung protective barrier nga para hindi na nababasa.
Correct.
So, sir, aside from diaper rash, ano pa po ba yung mga ibang rashes ng mga bata?
Yan. Okay, good. So, pag-usapan natin, sabi ko nga, I promise you will talk about the special skins of children. Ito na. Ayan. First, and one of the most common, yung tinatawag nating atopic dermatitis. Di ba, Jamie, yung dito sa Pinas, may tawag tayo dito sa atopic dermatitis or atopic eczema? Di ba, ang tawag natin dito is skin asthma?
Yes. Lagi yung sinasabi.
Yun ang Filipino term. But you know, there's nothing Filipino about it. First of all, it's both an English word. Skin asthma. Wala kang Tagalog dun no?
Oo.
Just to cut that short, ang asthma po talagang it is a lung disease. Hindi po yan disease ng balat. Kaya there's no such thing as skin asthma. Baka lang po may iba kayong kausapin, mga foreigner, ganon. I'm sorry, what's that? Di nila maiintindihan. So we call it atopic dermatitis or simply eczema. Para lang po we know our terms. Now, atopic dermatitis is what I call special skin. It is special because children with atopic dermatitis, they have sensitive skin. It's due to a genetic mutation in one of their skin genes. Kaya mas sensitive, na-break down yung skin barrier, nakakapasok yung irritants. Kapag pumasok yung irritants, mamumula, mamamaga, mangangate, kakamutin. Pag kinamot ng kinamot, ano mangyayari? Magsusugat. Ayan ang infection. Ayan ang itsura ngayon. Atopic dermatitis comes out a little bit later on in life, about 3 months and above, more or less. And it comes out in these special areas around the cheeks, inside of the thighs. Ito po yung thigh, ito po yung kanyang, yung sa likod po niya, yung tuhod, yung lower leg, tinaas lang po namin. You can see the eczema right here. And then also in the inside of the elbows. Yan po ang traditional, pwede rin pong kumalat-kalat sa katawan, but traditionally, these are the areas of classic atopic dermatitis in infancy. Ngayon po, meron siyang kahawig na gusto ko rin pakita sa inyo. This is called seborrheic dermatitis. Ito naman, madalas nakikita sa eyebrows, dito sa scalp, nangangapal yung scalp, di ba? Cradle cap na ang tinatawag. You can see there's also a lot of dry skin. Meron rin po yan sa cheeks. Mas madalas po, makikita niyan, meron din siya sa leeg, sa singit, which you really do not see in atopic dermatitis. This sebderm comes out much earlier in life, around 1 month of age, 2 weeks of age. Lumalabas na po itong sebderm versus atopic dermatitis that comes out a little later, 3 months. And atopic dermatitis is redder and more itchy. So yun po ang diferensya ng dalawa. Okay? Ano ang triggers ng atopic dermatitis kasi nga ito yung mas sensitive na balat. Well, you know, my grandson Mateo is having some atopic dermatitis. I praise the Lord that this atopic dermatitis is only mild. Ang hilig paglaruan yung cat nung kanyang great-grandma. This is the cat of his great-grandma. In other words, mother-in-law ko. O, syempre, mabait ako sa mother-in-law ko. Ayan. Pero ang hilig, ang hirap niyan, di ba? So, what are the triggers here? Heat, sweat, dust, dirt, saliva. These are the big 1, 2, 3, 4, the big 5. Ang tawag ko rito is the big 5. Welcome to Metro Manila. Welcome to the Philippines. Heat, sweat, dust, dirt, and saliva. What to do? You know, this takes a lot of heart. It takes a lot of purposefulness. We need to sort of like keep a journal of what the baby does, what the kid does, what are his habits, and where does he go, and to minimize. What about food? Is food a big deal? Parating tinatanong sa akin. Rarely. Actually, in my practice of over 30 years, I can count. I can almost count how many children have developed food allergy early on. Diba? And pets, okay, surely cats are more notorious than dogs. Kaya swerte ako nakuha ko ng picture to. Certainly cats are more dangerous to producing atopy as compared to dogs po yan. Okay, ito. Madalas din po, birthmarks. Yung pinaka-common na birthmark, yung po sa puwet, yung parang gray-blue, Mongolian spots, yung po pinaka-common sa mga Asians. Wala po yun, talagang balat po lang po yun. It just goes away after a few months, sometimes a couple of years. It's of no concern whatsoever, diba? Those things. However, this one called the hemangioma, kakapal po yan. Nangangapal po yan, and we need to treat this with medication, especially if it comes out in areas like the face, and you can see here, it is not a hemangioma, this is different. But if there was a hemangioma that came out around here, or maybe around the lips, or maybe around the throat, the genital area, we need to see it soon, because it's best to start treatment between 1 month to 2 months of age, so early on. In comparison, ito po ang tinatawag nating angel's kiss. Kita nyo, it's milder, but it's certainly very red. Meron din po siya medyo sa mata. Nakikita nyo, ayan, sa mata. Meron din po yan sa nape, sa batok. In the nape, we call it the stork bite. Yan po yung mga balat na mga of no concern also. Their vascular markings, they will go away after a few months. Mas matagal po mawala yung balat sa nape po. Okay. Now, this is in fact the most common skin infection in children. It's called Impetigo. Sa Tagalog, mamaso. Bakit? Tignan nyo po parang napaso, nasunog. You see this golden honey-colored crusting. Ayan, nadilaw-dilaw, sugat-sugat. Kumakalat po yan because of a superbug. We call it a superbug. The superbug is known as Staphylococcus aureus. The name Staphylococcus aureus comes from the word Staphylococcus, which means grapes. Aureus means gold. Pag makita po namin to sa microscope, ang ganda niya tignan. Golden grapes. Kaya siya gumagawa ng golden crusting. No, that's not true. But it is a golden crusting, and he is golden grapes in the microscope. And tinatawag namin superbug because I'll tell you the superpowers of Staph aureus. Number 1, nag-mutate po yan, parang X-Men. And when it mutates, hindi po siya mapapatay ng mga antibiotics. Kaya alam to ni Jamie, MRSA, methicillin resistant po sa antibiotic ang mga ibang Staph aureus. Next, marunong pong magtago to. It will hide by producing pus. When it produces pus, hindi po siya mapatay ng mikrobyo. Number 3, it will hide again, special areas. Marunong tumago sa ilong, sa likod ng tenga, sa kilikili, sa singit, sa puwetan. Magtatago po siya talaga. Dapat nating huntingin siya ron at patayin po natin siya. Kung hindi, why? Meron tayong tinatawag na paulit-ulit na Staph aureus infection. Okay, so these are just the things. When you see this, you have to bring the child to your pedia, to your health worker, because kailangan pong gamutin to, kailangan pong lagyan ng antibiotic, whether oral or topical or kahit na cream, ha? Okay.
Yes. Ayan, ang dami na nating na-cover, sir, Mula infancy hanggang hanggang mga toddlers and school kids, 'di ba? Itong mga infection na 'to. So syempre, sir, di natin pwedeng kalimutan yung isa pang section ng mga pasyente natin, yung mga adolescents or mga teenagers. Eh di ba ngayon, ang mga usual activities po nila, yung mga video, so mahilig sila mag-online, so syempre kitang-kita yung balat nila. So yung mga TikTok, IG live nila, lahat, di ba, na naka-video ganyan, mag-hi-hi sa mga tao. So paano ba nila, sir, aalagaan yung mga balat nila para magandang tignan sa camera?
Right. That's a great question. Di nga sabi ni Dr. Dumlao, no, ng DepEd, sinabi nga niya na yung special mention yung mga teenage skin. So let's go with that now. Diba? Ayan. Okay. This I want to talk about as well a little bit in depth. Kasi po, ang ating mga teenagers and adolescents, they are in that special category or stage in life where they're trying to get their legs into the real world. They're starting to think like an adult, but do not have the wisdom and the experience of an adult. But they want to make their own decisions. They're trying to find themselves. Kaya for us who try to help our teenagers with the care of their skin, which for them, teenagers, is very important, di ba? Especially that they are going outwards, social media, finding new friends, etc. So image is very important to them. So ito po yung ating philosophy. I call it the AEIOU philosophy. Ayan, you can read it there. Attitude. We probably need to figure out the attitude of our adolescents and teens. What is their outlook on hygiene in the first place? How do they view themselves, diba? And then let's think of their environment. Where do they hang out? Are they the type to just sit down with their devices the whole day? Or are they also the type of people who are more outgoing? They like sports, they like going out. They get depressed when they don't have face-to-face encounters, no? And then there is the letter I. What are the individual needs of our teenagers and adolescents? Is their skin naturally more oily? Is there more sweatiness that they have to sort out? Body odor, perhaps, no? Often, we as parents, we're a little busy. Madalas busy po tayo. So we just want to dictate. We just want to order. Oh, gawin mo yan. Do that, do this. Often that doesn't work. We should better try to offer. And we should also better try to understand them, communicate, and listen. That takes time. That takes, again, purposefulness. So ayan po. Our philosophy, AEIOU, especially for them, for you, not for me. Kanga nila, no? Okay, so ano bang pinaka-common na problema ng mga teenagers? Ito, nakikita na natin, di ba? Pimples. We call it acne vulgaris. Vulgaris means common. So itong pinaka-common cause ng pimples. Are there different causes for pimples? Yes. Yes, there are. There are, in fact, pimples in newborn babies caused by excess hormones. So that's not very important at this point. But there are other reasons for pimples, and we will show you later on. But in case of acne vulgaris, saan ba po nanggagaling itong pimples nito? What causes it? they come from oil glands. Let's just be clear. Lahat po ng pimples nanggagaling sa oil glands. And for the common pimples, we know for a fact that 85, more or less, 85% of the adolescent population, or maybe in the entire population of the world, will have pimples. 85%. But there is the 15% that do not have pimples. Yan po ang sumasali sa Miss Universe.
Swerte naman nila.
Diba? 15%. The same reason that I don't know what the OB will say the numbers are, but of all the mothers who have become pregnant, how many actually develop stretch marks, and how many mothers who have become pregnant have no stretch marks? There is that population. So in other words, what I'm talking about here is genetics. Kapag genetically not inclined to produce pimples, wow, para kang nanalo ng lottery. Diba? Parang ganun yun. The other thing, one big thing that causes pimples, hormones. Wala tayong magagawa. Pag teenager ka, talagang may hormones ka. And if you don't have hormones, hindi ka maging teenager forever, little cute boy, little cute girl ka. Hindi naman pwede yun, napaka-abnormal. So, when we have those things, yung pangatlo nga pala, infection. P. acnes, Propionibacterium acnes, that causes the redness and the inflammation of the pimples that are developing due to your genetics and due to your hormonal discharges. May hormones ka. So ang sinasabi ko po, pag meron akong mga pasyenteng may pimples, I ask them, what are your goals? I need to know, using the philosophy, what are your goals? May iba gusto talaga, Doc, gusto ko yung para akong Photoshop. Ang linis. Ma'am, hindi ko po kayang gawin yun. Hindi po ako magician. Unang-una, ayaw ng genes nyo. Pangalawa, tatanggalin yung hormones. So you cannot fight nature, in other words. So we have to set certain goals. We have to look at the outlook. We have to understand. O you see, akala nyo parang ano yan, Doc, philosophy ba lang yan? Hindi po. Ginagamit natin talaga yan sa pangangalaga sa balat ng ating teenagers, di ba? So ngayon, ayan, so let's be practical then. What are the do's and don'ts in acne? We already showed you this. These are your Sydnets. Yan ang mga gusto nating Sydnets, right? Please do be gentle with your skin. When you wash gently, no rubbing, no scrubbing. I usually tell my patients, do not touch your skin. Huwag niyong tirisin ang pimples niyo. Huwag niyong itutungkod yung kamay niyo sa forehead niyo kapag nag-iisip. Do not scratch. Sometimes it's the hair. Please check if your hair is irritating your skin on the face. Diba? The more you stay out sa init, sa lagkit, sa pawis, there's more irritation. Your skin feels all these irritations. Anong mangyayari? Your oil glands will react to the heat, to the sweat, to the dust. Mas dadami ang pimples nyo. So do's and don'ts. Next, do eat well. Eat well. Don't eat these things. First and foremost, sweets. Sabi niya, Doc, wala dyan ang oil. Well, contest fast food. But we've seen in our studies that sweets are more notorious in producing more pimples than oily substances. But because junk food is really junk food, fast food, then we say, no, please don't eat this as well. What about milk? It's a staple, right? Unfortunately, when they produce milk, they give hormones to cows to produce more milk. So what happens? Well, hormones, you know, that's bad news for pimples, diba? So ito po ang mga don'ts in terms of food. And finally, may I just say, habits. Do have good sleeping habits. The flip side is, what time does your adolescent sleep? tayo pong mga tao, actually, para tayong mga manok. Do you know that, Jamie? We are like chickens. We were made to
sir?
sleep at night and wake up in the morning. Meron ka bang alam na manok na gising sa gabi?
Wala, sir. Oo nga naman.
Tumitilaok sila kailan? At the break
Madaling
of day.
araw.
Oh, you
Yes.
see? Para tayong ibon. We sleep during the night. We were made. We evolved to be asleep at night. And bakit
Eh,
kaya sila
syempre,
gising?
alam
O
mo na,
bakit
sir.
ako? Ayan, ha?
Gadgets.
Aray
Diba?
ko. Ang tanong, ito, ano, so what? What's that with pimples? Hormones, stress. Mag-iiba yan. Maghahanap ng way out yung katawan mo kasi nai-stress dahil hindi niya gusto yung gising ka ng late at night. Pag-usapan ng maigi. Do not dictate. O ayan na naman, practical. Do not dictate. Pag-usapan, listen. Bigay ng mga magagandang options. Okay, here we go. Eto. Importante rin to. Hyperhidrosis means excess sweating and bromhidrosis means BO. Ang gandang word, no? Do you have bromhidrosis?
Ang hirap sabihin.
Para hindi nakaka-offend. Bromhidrosis.
Oo nga.
Body odor. But okay, let's talk here. Hyperhidrosis, excessive sweating, syempre, it comes from the sweat glands. Ito lang gusto kong sabihin. Ang sweat glands po, malaking controller ng sweat glands is our nerves. They say the main two things people are really afraid of is what? Death and public speaking. And that is when you sweat. Di ba? Pag medyo kinakabahan ka na. Dok, kinakabahan ka ba? Nagpa-public speaking ka ngayon? Siguro nasanay na ako. So, I'm more excited than nervous now. So, hindi na ako, unlike before siguro, I'm more nervous. Pero I'm just excited now to share with you everything. So, that is the thing that you have to understand. The other thing about sweating is clothing, Jamie. Nowadays, parang uso yata mas tighter ang clothing. There was an era before where clothing were so loose. Mas loose, parang ano, di ba? Lousy yung ano mo suot. Ngayon, mas tight yung mga shirt, yung mga lalaki ngayon, mas tight ang shirt, mas fitting. Problema yan sa hyperhidrosis. Also, the material that you use for clothing, satin, seda, cool, clean cotton clothing, again, is best. All right. O sige. Now, what else can we do about hyperhidrosis? Well, there's antiperspirants. So let's take a look at that antiperspirants. What are these antiperspirant things? Antiperspirants are these are chemical agents that reduce perspiration or sweating. And they have active ingredients in the form of what? Roll-ons, merong sprays, merong powder, formulations. And traditionally, they come out of aluminum salts or aluminum chloride. Mas advanced na po itong konti yung aluminum chlorohydrate po natin. Dok, anong mas maganda? Roll-on, spray, and powder or powder formulation? Ang worst is spray. Pinaka-irritating sa armpit area yung spray. So roll-ons and powders are better. How do antiperspirants work nga ba? So ito yung picture. Sige, pakita ko lang ito ang ating balat. Ito po yung ilalim ng ating balat. Ito po yung sweat gland natin. Yan yan o. So ito po yung butas ng sweat gland, yung bilog na yan. Pag nagsesweat po tayo, ayan, yung dilaw, yung orange, ayan po yung maraming sweat, ang dami. Yung red po, kapag nagpahid na tayo ng antiperspirant. Pag nagpahid na po tayo ng antiperspirant, anong ginagawa ng antiperspirant? Nagke-cake, bumabara. Binabara po yung butas ng ating sweat ducts. Ayan o. Kapag binara niya yan, eto, parado na. Mababawasan ang ating sweating. O, di ba okay? Kaya lang, Dok, kakatakot yan. Kung bumara ng bumara. Chemically, nauubos din po siya. Kaya after a while, wala na rin yan. Kasi chemical lang naman po yan. So, but just watch out, as in all chemicals, sensitive skin. Alright? Okay, so are antiperspirants the same as deodorants? Well, no, not really, no? Ito, nakikita natin. The newer generation antiperspirants, ito pong hahanapin nyo, aluminum zirconium compounds. Why? Kasi for those who shave, diba, yung mga irritation, etc. So less kapag may aluminum zirconium compounds. And then for those who want to use powder, ito pong hanapin nyo, difenyl methyl sulfate powder is also very good as an antiperspirant po, para lang alam nyo, ha? Now, for deodorants, yan. They are not antiperspirants. They do not prevent sweating. However, meron po tayong tinatawag, ay nga pala, bakit pa tayo merong body odor? We have scent glands. Yung scent glands po natin, kasi glands sila, they secrete substances. Pag kumuha po kayo nung substance na yon at inamoy nyo, wala pong amoy yun eh. They have pheromones though, and for animals, they use it for mating purposes. Oh, yun. But that's what it is, it's an animal thing. But it has no smell. Paano nagkakaroon ng body odor ngayon? Eto na, kapag may mikrobyo. Kapag may mikrobyo, maghalo ang mikrobyo at yung katas ng ating scent glands, lalabas po yung amoy. Kaya cleanliness is very important here. Okay? If I may also say, because these are chemicals, does anyone notice pag meron silang BO at meron silang favorite na ginagamit na shirt, yung favorite shirt na yon, maski nilinis, pag ginamit, meron pa ring amoy, yun ang mabilis umamoy. Because of the chemical. So you have to wash it properly. Yun lang po. Please take note of that. And then also in terms of clothing, para lang po kung minsan hindi napapahiya, that sort of thing, image, especially for teenagers, di ba? Tell them to wear something na kapag mabasa, hindi obvious. Merong klaseng cloth na kapag mabasa, makikita mo basa. Diba? Maski spilled water from drinking sa shirt, makikita basa. So test that and see which one is best. Okay, so ito po yung mga iiwasan natin for sweat and body odor aggravators po. Ha? You can see here that the spices, yes, yeah, there are certain populations of individuals who love spices. So alam niyo na yan. And then also, yung mga mahihilig sa mga mag-saute. Mga, di ba? Ginisa, garlic and onions. They asked me, Doc, why is broccoli, cabbage, Brussels sprouts, cauliflower, and asparagus bad? Aren't they healthy foods? Aren't these healthy foods? What's wrong with them? Because if you eat a lot of these things, they produce sulfur. Sulfur, when secreted, produces sweat and body odor. And of course, alcohol. So ayan po, syempre, pag meron naman tayong diabetes, yung may ibang mga sakit, mga sa babae, much older, hindi na po teens to, no? Menopause na yan eh. Liver, kidney diseases, talaga pong nag-iibang sweating and body odor po natin. No? FYI lang. Okay. Ayan. O ayan, special. Ayan, Jamie, ito na ngayon yung mga common skin problems na nakikita natin sa teenagers. Number 1, pantal, pamamantal. We call it acute urticaria, allergies. Most often, it's physical. Pag nagkakamot, naglagay ng letter Z nga siya rito. Ito, kitang-kita. It's called dermographism. Ayan o. So sa kakakamot lang ng bata o kaya sa kakapawis, sometimes we're allergic to our own sweat. There's such a thing. Tapos mga ngati ka na, lalo na sa alikabok, house dust mites. Kapag nag-exercise, those sorts of things. Anong ginagawa rito? Antihistamine is the staple, but what works even better is to identify the triggers and to avoid them, right? Okay. This one, balikan natin si Superbug. Staph aureus. Paano nagkakaganito? Well, some people, as I say, if their personal hygiene is not so good, they're more itchy. So they scratch. Saan nanggagaling to? Usually from the hair follicles. Kita nyo, ayan o, parang meron tuldok sa gitna. Ayan po. Nanggagaling po yan sa butas ng hairs. Kapag kinamot yan ng kinamot, dyan po papasok ang mikrobyo, dyan po manganganak yung pigsa natin or boil. Therapy-wise, I would really rather you get it early. Get it as early as this, not this. Ito palaki na yan eh. What do you apply? You apply a topical antibiotic. You should probably see your doctor to see which topical antibiotic to apply. Kapag yan po eh, medyo kalat na, masakit, maapde, malaking boil, you probably need to take your oral antibiotic as well. All right? And then finally, ito very common. Let me tell you something about this patient. This is one of our patients in National Children's Hospital. Noon po, nakita namin itong pasyente, nandito ang rash niya. Do you see this? Yan o, Jamie, ayan o. Meron siyang rash dito. Yan ang original rash niya. Napagaling na namin eh. Tapos bumalik, ito na ang kanyang rash, bago, puting-puti. An-an po to. Ito yung tinatawag na an-an. Yan po ay galing sa amag talaga ng katawan. He's a very good basketball player, this teenager. Problem is, he's a little lazy. So he plays basketball, he's one of the stars, and then he dries up, he changes his clothes. Sometimes, kakain na lang, and then he sleeps kasi he trains. Team siya. He's in the school team. So, minsan pagod na sa lahat, and he just sleeps. So, nung ginamot natin siya, gumanda, ayun, nawala na. Pero bumalik. Tapos tinanong namin, have you changed your ways? And he said, yes, Doc, I already take a bath. And so bakit to, Doc, bumalik? Good boy na ako. You know where we found out the problem was? His towel. He doesn't change his towel for over 5 days. 5 to 7 days, ang towel is the same. Where do you think the amag spores are coming from then? Saan nanggagaling? Sa towel. Nung pinalitan na natin ang towel niya, pinaganda natin ang habits niya, sinuri po natin mabuti yung kanyang day-to-day, napaganda po namin. And the trick is really, well, we have to give a proper antifungal. Ayan, ha? So that is the story of this patient here. Okay, so I think that's it for now. And Mateo is saying thank you. Thank you very much for your kind attention. Salamat sa inyo lahat.
Thank you, sir. Sobrang dami naming natutunan this morning. Thank you so much. So yan. Sir, habang nagle-lecture ka, may mga nagtatanong na, pero babasahin ko yun in a while. So everyone, kung may questions pa po kayo, paki-type lang po sa chat box sa Facebook and dito sa Zoom. Bago ko po basahin yung mga questions nyo, gusto ko lang mag-hi ulit to everyone who's joining us. Yung iba kasi parang hindi na natin nabate. Nag-start na tayo, sir, kanina. So hello again, everyone from all over the Philippines. Ang daming mga provinces na represented na nakikinig sa atin today. And sir, meron tayong mga kasamahan sa TMC na nandito rin today.
Wow, sino sila?
Sila
si Shock, si Dr. Shock.
Yes, si Dr. Alfonso nandito rin po.
Alright.
Tapos
Hi, Mark.
Nakita ko kanina si Ann Gomez. Hi, Ann.
There, si Ann.
Ako yung iba, baka hindi ko mabasa. Wag po kayo magtampo. Sorry. Ang dami po nito. Hindi ko madadaanan lahat. But hello to everyone. Yung mga colleagues namin from TMC who's here. Dr. Dando, si Dr. Farah.
Oh, wow.
Dito. Dr. Alonso, good morning.
Si Paula.
Yes,
Hi to everyone. Good morning. Thank you for joining.
Sir, ready ka na ba sa questions?
Yes, please do.
Sige.
I hope I can answer them all. Yeah.
Oh, sir, kaya mo to. Simulan ko na po. Yung first question, balikan ko po kanina. Tinanong to dun sa umbilicus or yung sa umbilical stump.
Yeah.
Ang tanong is ni Miss Socorro, pwede din po ba gumamit ng betadine with lowest percentage in cleaning the umbilical cord? Ay, sir, sorry.
Go ahead.
Pwede pong pa-stop share na. Para po makita ng lahat ang beautiful faces natin.
Ah, how's that?
Ayun! Ayan, sir.
Yan.
Ito po, ayan.
That work?
Yes, sir. O, balikan ko po yung question ha. From Ma'am
Alright.
Socorro. Pwede din po ba gumamit ng betadine with lowest percentage in cleaning the umbilical cord?
Okay, so povidone iodine is an antiseptic. And so the reason why anyone would want to use that is because they are preventing infection of the umbilical stump. It kind of depends on where you are. If your surrounding and environment is really quite toxic, some people will say, well, I don't really have a toxic place. What's a toxic place? Not some of us are not as blessed as others, and so the surroundings might not be as conducive to cleanliness as others as well. What we would rather recommend is chlorhexidine rather than povidone iodine because that's no good to be absorbed, and iodine is not really a good thing for the thyroid.
Okay, sir. So, chlorhexidine.
Chlorhexidine.
Na lang po.
Why not alcohol na lang? Alcohol also is not very good when it is absorbed, and that's for the liver naman. Liver.
Okay, sir. Pero kung wala naman, kung malinis naman talaga, water lang po, di ba?
Yes,
Sabi
yes.
ko kanina.
Right.
Okay.
And for everybody else, na kaya naman it's their environment is conducive to cleanliness and there's no other issues. Like another example is if you are not hands-on and somebody else that you do not trust is going to be handling your child, so you probably need to take care. Dr. Jamie said, as much as possible, just really want water and
Water. Ayan. Sige, sir. Next question. From Dr. Mark Mendoza. Is it okay to use papaya soaps in children? So, papaya.
Not all papaya soaps are the same. Iba-iba yan eh. Di ba? Hindi naman pare-pareho. If they were developed and produced the same way as most soaps are, that's an alkali.
Mm-hmm.
So that's automatically X po yan sa akin.
Hindi agad. Okay.
And other thing, papaya, mabilis lang. The papace itself, it's not that useful. So that's more a marketing thing. Yeah, hindi rin magpapaputi. Yeah.
Hindi rin pala. Okay. Thank you, sir. Nice
Not for
to know.
kids.
Syempre po, not for kids. Sige, sir. Next, from Mr. Ralph. Doc, yung pagpupuyat po, nakaka-cause po ba ng acne? I think na-mention yun na to kanina.
That's right. Yan.
Yes.
Tapan na natin. Yeah.
So, yes, no? Because of the stress and hormones and yung inadequate sleep, no, sir?
Yes.
Ayan.
Right.
Okay. Next, from Miss Yonilin. Doc, ano po ang difference ng atopic dermatitis sa dry eczema?
Dry eczema. Dry eczema is a description, partial description of atopic dermatitis.
So same lang siya
Kapag sinabing may dry eczema, ibig sabihin hindi siya yung basang may sugat na may katas.
Opo.
Yun ang dry eczema. It is also atopic dermatitis in a different state.
Okay. Sige, yun pala siya. So
moisturizer po ang kailangan ng pasyente na yun. Siyempre kasi dry. Yeah, moisturizer.
Kasi dry.
Yeah.
Okay. Yan. Thank you, sir, for that clarification. May mga tanong pa tayo at tinatry kong i-cover lahat kasi malapit na tayo mag-time. Okay, next kay Ma'am Karen. Doc, what can you say about using tawas for armpits? Naku, popular to sa Pilipinas.
Yun, yung tawas. Alum. Alum yun eh, tawas. It's a drying agent.
Okay.
Yes, oo. Diba?
So, pwede pala talaga
traditionally,
siya.
they have used that. Pero po yung tawas, nakakasunog ng balat.
Okay.
Yeah, if you use it, some people parang initially, wow, okay, parang nagda-dry ang balat ko, di ba? And then the more they use it, kasi ginanahan sila, masusunog. Kapag
Kaya
masunog ang balat natin, baka mag-hyperpigment naman.
Yun nga sasabihin ko, sir. Kaya ba nangingitim? Pagka tawas
Also,
yung
because alum is a strong chemical.
Ayun po. So dapat, ano sir, dapat hinay-hinay ba sa paggamit or completely iba na lang gamitin
Wag na lang
instead ng
kasi hindi mo
tawas?
makontrol yun eh, di ba?
Opo.
It's a pure chemical. When you get it as a crystals yan eh.
Opo.
Clear
Oh,
crystal.
diba?
Dirty
Okay,
white
sir.
crystals. Oo.
So
kapag
iwasan na lang natin.
Kapag yan, binili nyo na sa ibang tao, may halo na yan. Yun ang problema. Hindi mo alam kung anong hinalo nila sa tawas. Pero doon sa
Correct.
probinsya, nakikita ko eh, you can buy tawas as a crystal, as a rock.
As in, sir,
Pure.
yung mga malalaki?
Oh, they crack it. Inaano lang, minamartilyo lang nila,
Didikdikin.
tapos ibebenta nila per weight.
Okay. Naku sir, di ko na naabutan yun.
So,
Ang nakita ko na mga nasa plastic.
Nakakita ko ng tawas, pure. Pero ngayon,
Ganun pala.
hinahalo-halo nila, crystal, kung ano.
Oo nga, sir.
Mas mahirap.
Opo. Ayan. O, sige. So, iwasan na lang natin.
Yes.
Yan. May questions pa tayo, sir, ha? Few more
Yes,
questions.
please.
Is it true, from Doc Para, is it true that applying alcohol to the umbilical stump will dry it out faster and make it fall off earlier?
Will it dry it faster? Well,
Yes.
It could, but you could irritate the area faster as well.
Okay. O nga, no?
Because alcohol, how does alcohol dry? Through evaporation. Just like anything else. If you keep on putting water on your lips, like laway, etc., it will dry your lips. You'll have very dry lips. It's because of the evaporative process. So alcohol evaporates much faster because of its density. And so if you evaporate it a lot, it will dry faster. But that's not all what alcohol does. It's also an irritant. Also, there's absorption. So you need to weigh. In other words, para titimbangin natin ngayon to. Ano yung gusto mo, yung drying, o anong gusto mo yung other side effects ng alcohol? What outweighs the other?
Okay. So case to case basis, sir, no, yung paggamit.
For me personally, I think if you just weigh it all together, there are more negatives to the positive.
Okay. So we should keep that in mind pala bago tayo mag-decide kung gagamitin natin yung alcohol. Okay. Sige.
Right.
Next, sir, from Miss Sabrina. I noticed that my teenage son started having a lot of dandruff when he hit puberty. Sometimes the usual anti-dandruff shampoos are not that effective. Is it advisable to let him use anti-dandruff shampoo every day? So yun yung question niya.
Okay, so anti-dandruff shampoos contain things like zirconium and other chemicals as well. But there are a lot of reasons kasi for dandruff. Again, oily scalp comes from hormones, and your stage in life also comes from stress. Sometimes it is also genetic. We have seen many times a child with dandruff, then I check the scalp of the mother and the father who accompanies the child, and I rub the scalp of both parents. They also have dandruff. Hindi nila napapansin yung dandruff nila, napansin nila yung dandruff ng anak nila. It's genetic. So, mahirap yun. We need to see the cause. Sometimes it is due to yeast. You can smell yeast. Sometimes I smell the scalps of, if you've smelled enough scalps, you know that this scalp smells like maasim, yung mga bata, or normal scalp, or yung iba may amoy amag na talaga.
So
you won't
dapat
see it, but you can smell it. So the answer is, it's difficult to give you a direct answer to the questions. You need to find out the cause.
Yes, yun nga. So kailangan po nilang ipa-check, no, kahit dandruff lang siya.
Especially if it is an itchy at sugat-sugat ng dandruff.
Kawawa naman. Okay, sige sir. Itong next question.
Thank you for that question.
Thank you, ma'am. Si Ma'am Sabrina, thank you po. So next question from Miss Marilyn naman po. Hello, Doc. My grandson have hemangioma.
Hi, Marilyn.
What is the proper medicine that we can use? It's in his cheek, Doc, from Panabo City.
How old is the baby is the question. And then next, up from where?
Sabi lang niya, Doc, cheek. Panabo. Panabo.
Saan yun?
Hindi
Saan
ko
po
po alam,
hanapin
di ako
kaya, no?
familiar. Kay Nancy
Anyway,
baka sabihin
no,
niya sa akin.
natanong ko lang kasi, yeah, that there might be some urgency sa cheek.
Mhm.
We give something called propranolol. Yeah.
Sir, baka dapat ipa-check nila muna,
Yeah,
no? Kasi
we
yung
give something like
dose.
propranolol.
Mm-mm.
I certainly cannot give you the prescription. It's because
Yes, of course.
uh, you cannot, you won't be able to give it. It's
Mhm.
it's a drug na binibigay ng
Na
doktor.
with prescription, yes.
Yeah,
So,
yeah. So wala pong pahid. Kung ang tanong ko, ano pa ang pwedeng ipahid sa hemangioma? If I may refine the question, di ba? Wala pong maipapahid sa hemangioma na magpapaliit po sa hemangioma. Ang
mhm.
ang pinaka-effective po na propranolol, pero po yan talagang kailangan suriin ng doktor at
Correct.
ibigay ng tama. Why? Kasi po marami side effects din ng propranolol.
Yes. So, yun po, Miss Madeline, kung meron pong malapit sa inyo na pediaderma, baka mas mabuti. Or sa sa pedia niyo po mismo kung walang pediaderma.
Ang
Ma'am,
TMC po, maraming kaming mga derma ron na pagpipilian niyo po. Look at the TMC. Tawagan niyo po ang TMC,
website.
pamili po kayo ron.
Yes, so yan po. So siguro we have a few more questions na lang
Oo nga,
to
mukhang marami. No?
cover.
You're welcome, Marilyn.
Yan, sige kasi sir, medyo para maano natin. Ito si Doc para ulit. What do you advise patients and parents concerned about the treatment of scars?
What kind of scars? Okay, not all scars are the same. There are keloid scars. There are scars that are just plain scars.
Mm-hmm.
And there are scars that are not scars but are actually post-inflammatory hyperpigmentation or post-inflammatory hypopigmentation. So depending on the type of scar, Farah, then we will address that properly. But in 80 to 90% of cases, we leave it alone for small kids because small kids, they renew their skin so well. They're in that stage of renewal, and scars take care of their own as long as they do not damage the dermis too much or the deeper lining of the skin.
Okay.
In-address ko si Pare kasi doktora yun eh. Kaya,
Oo nga. So, kailangan pa rin ng assessment. Sir, last two questions tayo ha.
Sure.
First question, galing kay Sir Calvin. Tanong ko lang po kung okay lang ba gumamit ng aloe vera products every day sa face or body?
Aloe vera. Okay. Aloe vera has moisturizers. It also has got some enzymes inside the aloe vera. Oh, alam ko kasi meron akong aloe vera plant. Oh, di ba? I never use it. But I don't know the gentleman to no na nagtatanong.
Yes.
Anong pangalan niya?
Calvin.
Calvin. Ikaw ba kung ikaw mismo gumagamit, I obviously need to know what has happened to the skin, if you've been using it for so long, has it had any effect, or are you happy with it, or there's nothing that's happening to your skin? Because yes, there are good reasons to use the aloe vera. It has been studied, just like virgin coconut oil. But as I said, it's a case to case on why you're using it. I don't know why you're using it. Is it just for maintenance purposes? Is it because you have blemishes or something? Doesn't say, di ba? So, but
yes,
answer is, kung hindi naman nakakasama sa balat mo at you're happy with what's happening, the answer probably is yes, it's all right. Yes, please continue, carry on. Just be careful.
Yes, ayan. Parehas kami. Ako rin gumagamit ako ng aloe vera, sir, sa face ko.
Wow, kaya pa kita. Ayan, Calvin, tignan mo naman. Tampon.
Nag-share talaga.
Oh.
Ako nagpipink. Ayan, oo. So, yon sir. Sorry, sir, sabi ko last two questions. Naging 3 pala. Second
Thank
to
you,
the
Calvin.
last na to. Thank you, Sir Calvin. Sabi niya, actually po, mother po ako ni Calvin. Si Calvin pala ay bata. Thank you, sir. Actually po, mother po ako ni Calvin. So, si Calvin,
Si Calvin ang gumagamit. Hindi
yung bata. Oo, tapos mother. Mami, sino gumagamit? Ikaw o si Calvin?
In any case, yun nga, yun din ang
niya.
sagot naman eh. So please check kung wala namang nangyayari. Tuloy lang po. Just
Ayan. Sir, second to the last question.
Yes.
How to address keloids for teens po, Doc? Yun din ba
Keloids,
yung...
talagang keloid. Kung talagang keloid,
Yes,
keloid is
from
a
Miss
problem.
Marcia.
Depends on where it is.
Okay.
Because keloid is really a genetic predisposition to thicken. Mag-hypertrophy talaga ang balat. That is a science of its own. Some people, they try to remove it surgically, but after surgery, they need to radiate the area. They radiate it with X-ray in a special way with cones. You know why? Kung hindi, maski surgery mo yun, yung surgical scar, keloid pa rin.
Opo.
So
Oo
you
nga, no?
di ba?
Sugat na
Exactly.
naman.
Exactly. Now, the easiest classical ways for us to inject that scar with steroids, intralesional steroid injections. It's quite painful. You do it almost every 1 to 2 weeks for many weeks until, anong mangyayari? Parang tinutunaw nung steroids na injection yung makapal na parang buhol-buhol na collagen fibers sa loob. Kaya siya naging scar. So tinutunaw, iimpis lang, pero nandun pa rin siya.
Ayun.
Mas hindi na lang siya ganun parang galit na makapal.
Opo. So, Ma'am Marcia, yun po ha. So, dalhin niyo po sa doctor para ma-assess yung keloid.
Yan. Keloid, kung talagang keloid. Alam nyo, yung mga ibang mothers sinasabi, I have keloid, doc. Then I look at the keloid. Hindi naman po yung keloid.
Okay, ayun pala. So, kailangan tignan pala muna. Okay, sir. May 2 questions about axillary area or kilikili.
Sure.
First is from Ma'am Mary Susan. What is the best advice to give to teens on how to remove axillary hair or extra hair?
Okay. I've done some research on that. You know, I actually anticipated that question. And it's a mixed bag. But basically, the number one thing we don't advocate is chemicals. It's irritating. The best, if you can afford it, is really the laser.
Okay.
That's the easy answer. What if, doc, medyo mabigat yun? Yes, okay. So what's the best thing? An electric razor.
Electric razor.
Electric razor is the less irritating. Why not the regular razor lang, doc? Basta ano. You can, but you know, there's more prone to irritation. The electric razor, because of its design, is less irritating, really. And then what about waxing? Di ba yun? Yun ang tanong. Waxing. Yun ang talagang maraming all kinds of irritation. For those who have already waxed, what are your experiences? Well, I've seen some. It's red, it's irritated, it's totally red, and sometimes painful afterwards. So kung minalas kayo at yung balat nyo mangingitim po yun, what we call post-inflammatory hyperpigmentation.
Ayun. Sir, dahil nabanggit mo yung pangingitim, ito na talaga, promise, last question na po talaga.
Nakita ko yung ano, kaya ako nabanggit yan kasi nakita ko nga yung
dalawa sila, sir, nagtanong. Pagsamahin ko na po kay from Vilma and from Maria Teresa. So, Doc, medicines or cream that you can recommend for darkening of armpit due to antiperspirant spray?
Okay, number one, stop your antiperspirant. How old is the patient? Number 2, do not rub and do not scrub. The more you rub and scrub, the more your melanocytes will feel, uy, anong nangyayari dito? Why is there a lot of friction? Gagawa sila ng melanosomes. Pag gumawa ang melanocytes mo ng melanosomes, iitim lalo.
Itim lalo. So
yes.
Stop, don't scrub.
Yes, and then wear loose clothing.
Okay. Sir, may i-apply ba? Para
yung i-apply para pumuti, usually kusang mamumutian unless, and then here's another big word, merong mga tao, mga Pinoy, kasi Pinoy may color eh. We call it acanthosis nigricans. It's a big word. It's a doctor word. Acanthosis nigricans, nasa lahi po yan, lalo na yung mga African Americans, they really have darker napes, darker necks, darker armpits, groin areas, right? And
Opo.
so that's by nature that it's really darker. And there are also medical problems like metabolic syndrome. Alam to ni Dr. Shok. Ayan, hello Shok. Oo. We need to sort it out if there's metabolic syndrome, sugar issues in the blood, etc. And then there is cosmetic dermatology.
Ay,
That's a totally different ballgame. Okay, cosmetic dermatology is a subspecialty of dermatology, and they've got all kinds of tricks in their bags concerning persistent and yung talagang non-medically related pigmentation of sensitive
opo.
areas.
So
So I
yun,
think that's the answer to that question.
to the question. Sige sir, maraming salamat sir sa lahat po ng mga nagtanong. Salamat din. So sir, may mga greetings sa chat box. Hindi ko na po isa-isahin.
Most
Nagte-thank you sila
welcome,
sa inyo.
everybody.
Good lecture
Most
daw. Very
welcome.
informative. So thank you everyone. So before we end, sir,
Mhm.
lang, sir, ha? May papakita lang ako. May we have a few words from you?
Okay. Ito, I just wanted to leave you, right, with my little message, and it's from Psalms. It talks about us, no? And Psalm says, "You made me all the delicate inner parts of my body and knit me together in my mother's womb. Thank you, dear Lord, for making me so wonderfully complex. Your workmanship is marvelous, how well I know it." At ito lang, pasalamat tayo. All of us have a lot to be thankful for. And I thank everybody for your kind attention and your time and for all your questions. I'm so glad to be of service to everyone today, to my colleagues as well. And so I wish everyone a wonderful and great weekend ahead of us. Thank you.
Yay! Thank you, sir. Thank you so much. Happy weekend also. Bye, sir.
Bye-bye. Bye-bye.
Bye.
Bye.
Yan. So, thank you very much for participating in our webinar today. I hope you had learned a lot from Dr. Pagyo. We will be providing a certificate for this webinar. So please just scan the QR code, click the link on the chat box, or click the link on the chat box. The link will be open until 5 p.m. today. We will go back to this slide in a while. So for inquiries about our pediatric dermatologist, Dr. Pagyo, and other specialists at the Medical City, please contact the Institute of Pediatrics with this number. And just a reminder to all parents, aside from COVID-19, there are many vaccine-preventable diseases. Please contact your pediatricians now to get your children's vaccines updated. We would also like to invite you to our upcoming webinars. So we have regular paid webinars from the Center of Developmental Pediatrics. This June 11, 2022, we invite you to the webinar Feeding Them Right, Experts Guide in Feeding Your Kids. Through this webinar, you will learn how to prevent and also handle common feeding issues. You may register via this QR code. You are also invited to our parent classes. So the parent classes for 2022 are posted on Facebook. Regular parent classes tackle feeding, behavior, and language issues. Please just check this out on the FB